Welcome to this explainer. Today we're jumping right into a tiny but absolutely crucial piece of the fertility puzzle, and that is vitamin D. We've pulled together some really great clinical insights to create this supportive guide just to help you better understand your reproductive health.
Navigating fertility care, honestly, it can feel a bit like you've been dropped right into the middle of a maze without a map. Between all the medical jargon, the endless appointments, the emotional highs and lows, it is completely normal to feel overwhelmed. But I really want you to remember one thing right off the bat. You are definitely not alone in this. Millions of people are walking this exact same path, and the medical science supporting you is advancing literally every single day. So we're going to break down that science into bite-sized, manageable pieces today, so you can feel totally empowered in those conversations with your medical team.
You know, when you're trying to conceive, it's so easy to feel like absolutely everything is out of your hands, or like every single intervention has to be this huge, complex medical thing. But the beauty of what we're looking at today is just how incredibly manageable it is. Checking your vitamin D levels, that's a simple, actionable step. This definitely isn't about adding another heavy worry to your plate. It's actually about finding this accessible, everyday helper that you can actively control. It's basically one small lever you can pull that has this wonderfully positive ripple effect on both your overall wellness and your reproductive goals.
Okay, let's demystify what a doctor actually means when they throw around the word deficiency. The word itself sounds super intimidating, right? But simply put, a vitamin D deficiency just means your body doesn't have quite enough of this specific vitamin to stay in its optimal, healthy state. At a really basic level, your body actually needs vitamin D to absorb calcium, which we know is the main building block for your bones, so it's kind of a foundational element, essentially the key that unlocks your body's ability to use other nutrients.
But it really does do a whole lot more than just help your bones. It's a massive multitasker. It supports your nervous system, your muscle function, your immune system, the whole shebang. But here's what's really fascinating and honestly a bit surprising: the lack of symptoms. Most people who have a deficiency, actually scratch that, a huge majority of people have absolutely zero symptoms at all. You could be walking around right now feeling 100% fine and still be running a bit low. Now, in really severe cases, people might get bone pain or weakness or catch frequent infections, but for most, it's totally silent. So if you haven't noticed anything wrong, please do not feel alarmed. That is incredibly common.
So, we know it's a big deal for bones and immunity, but why on earth are we talking about it in an explainer about fertility? Well, this is where we start connecting the dots from your everyday wellness directly over to your reproductive health. Emerging clinical studies are showing us that vitamin D is definitely not just a background player here. It is an active, influential factor in baby making. Your body operates as one deeply connected system, right? And when we optimize the foundation, like this essential vitamin, we basically create a much more welcoming, supportive environment for conception.
To understand exactly how it impacts fertility treatments, let's just pause for a quick second to make sure we're all completely on the same page with the terminology, because we never want medical jargon to get in the way. If you've been looking into fertility care at all, you've definitely seen the acronym IVF. As clinical sources define it, in vitro fertilization, or IVF, literally means fertilization that happens in a laboratory outside the body. It's this amazing intersection of biology and medical science, but the success of it is still heavily influenced by the overall health of the body it ultimately returns to.
And here's another phrase you're going to hear constantly, which is deeply connected to what we're talking about: ovarian reserve. Very simply, your ovarian reserve refers to the supply and the quality of a woman's eggs. Just think of it as the current status of your reproductive potential. When clinical studies look at how nutrition and vitamins affect you, they're very often measuring how those things impact this specific reserve. Knowing this just puts you in the driver's seat, so you know exactly what your doctors are looking at when they run your blood panels. And studies from ART Fertility Clinics reveal a really striking contrast when we compare these levels. Women who are deficient in vitamin D very often see a significantly lower ovarian reserve, and that can unfortunately translate to reduced pregnancy rates during IVF. But on the flip side, having adequate levels is directly linked to producing good quality eggs and successful embryo implantation. That is a profound difference. It means that actively addressing this one vitamin is a super tangible, positive step you can take right now towards your goal.
So now that we know why it's such a game changer, let's shift over to the how. How do we actually get from deficient to adequate? Well, the absolutely great news is that you don't need some intense, stressful routine to fix it. There are super simple, everyday ways to recharge your levels naturally. It's really just about making a few small, mindful tweaks to your daily routine that support your body's natural ability to thrive. Let's look at the best ways to start building those levels up.
The absolute most natural way our bodies create it is, of course, through moderate sun exposure.
But it's actually not quite as simple as just stepping outside for 2 minutes. It depends on 3 main variables. First, the time of day really matters because you need the sun's rays to be at the right angle. Second is your natural skin tone. Studies note that paler skin actually produces vitamin D more quickly than darker skin because darker skin naturally has more protective melanin. And third, well, that's just the amount of skin you actually have exposed to the sunlight. Knowing these 3 things just empowers you to manage your outdoor time way more effectively.
But of course, sunshine is not the only way. While this vitamin is only found naturally in a few places, the foods that do have it are wonderful, everyday staples that are so easy to add to your plate. We're talking about fatty fishes, salmon, tuna, mackerel. If you happen to enjoy beef liver or cheese, and let's be honest, any excuse to eat more cheese is a win, you're totally in luck. Mushrooms and egg yolks are also fantastic. And because it's such a big deal for public health, a lot of everyday items are fortified with it too. Things like dairy products, your morning orange juice, and breakfast cereals. Tossing a few of these in your grocery cart is a really proactive, easy way to support your fertility.
Now, as you start grabbing a bit more sunshine, or maybe adding some salmon and fortified OJ to your routine, please remember this. You do not have to figure all of this out on your own. You absolutely don't need to guess if your levels are adequate now. Partnering up with your medical team is the absolute best step you can take. They can easily check your exact levels with just a simple blood test, and then they can give you a tailored plan. Maybe they'll recommend a specific supplement if the sun and food just aren't quite cutting it. Your clinic is your partner here, ready to back you up with exact science and genuine care.
The biggest takeaway here is summarized so perfectly in this direct quote from the clinical studies at ART Fertility Clinics. Adequate vitamin D levels result in good quality egg production and successful embryo implantation. I really want you to let that sink in for a second. Such a simple vitamin, but such a massive impact. It is so reassuring to know that just by optimizing this one everyday nutrient, you are actively and beautifully supporting your dream of growing a family. It's literally just science working in harmony with your body's natural potential.
As you think about your next steps, whether that's just taking a quick walk in the sun, maybe throwing some mushrooms and eggs into your breakfast tomorrow, or calling your clinic to schedule that simple blood test, I want to leave you with one final thought. Just how much unseen, natural potential does your body hold, just waiting for the right, simple nutrients to unlock it? Thank you so much for letting us be a small part of your journey today. We are wishing you all the absolute best.